Hey guys, Dr. Mike here, Oak Brook Medical Group in Oak Brook, Illinois. And I got a question for you. Are you currently, or anybody you know, dealing with numbness and tingling running down the leg, pain in that low back, pain in one of the glutes, kind of underneath that butt cheek? If so, there is a whole slew of things that can be causing those issues. Everything from disc issues to biomechanical issues to postural issues to sprains, strains in the lumbar. I would love to be able to tell you in this video exactly what it is, but that's why we do the assessments in this office. There's a lot of anatomy that happens down here in this low back. So one of our number one goals is to always find out exactly what is causing your pain so that we know specifically how to treat that problem for you to get you out of pain as fast as we can. So I want to show you guys a couple things that could be going on. We're going to actually go look at some x-rays real quick. So follow me here. We do x-rays in the office. The majority of our patients, I would say, that come through here, and there's always a couple things that we're going to be looking for. So, low back specifically comes in. Patient, we want to look at the pelvis, lumbar spine, low back, and obviously you can see with this patient here, this is like we're looking behind the patient. So this is the right side, this is the left side, and that whole pelvis is shifted and dropped on the right. So this solid line is showing right where the tops of those iliums are, and the dashed line is parallel to the floor. That's where that should be. So we've got a big drop on that right hip, and you can see even a big drop in the hip joints themselves. So we know when a patient like this comes in and says, "Doc, I've got pain that's running down my leg," and then we see this big shift in the pelvis, we know that's contributing to it. It's, one of the things that we need to address. But then two, looking at it from the side here. So this is the lumbar spine of the patient. Like they're looking out the door. Let's actually pull up the other one just so you guys can see this. So a little bit dark there, but what I want you to realize and point out is, see this big open dark space here, big open dark space there. Those are the discs. Whenever you hear somebody say, "Hey, you got a herniated disc or a bulging disc," that's the part that we're looking at. Here's the deal. We can't look at an x-ray specifically and say, "Oh yeah, based off that, you have a herniated disc." A herniated disc is soft tissue. We need to look at an MRI for that. Now, can we look at this disc and this disc compared to that disc? See how thin that dark line is right there? And know, hey, there's a good chance if we send you for an MRI, something with the disc is going to show up. You clearly have degeneration. There may be a herniation in there. There may be an annular tear, which is actually a tear in the disc that's contributing to your pain. Absolutely can say that, but we're always going to want the MRI to be specific and know exactly what it is. So that's a big contributing factor: degenerative disc disease, loss of disc height. The other thing that this guy was dealing with is if we draw a line down the back of these bones, everything lines up pretty darn good right there. And then all of a sudden I have to stair step back. And then there's the back of the L5 there. So that's what's called a spondylolisthesis. This bone, there's enough degeneration in that area that that bone has shifted backwards on top of the other one. Well, these dark holes right here, those are where those nerves come out and make that sciatic nerve that everyone always talks about. So you can imagine this patient specifically with that spondylolisthesis, that bone has shifted backwards, making that hole smaller. We're going to have some irritation on that nerve that was contributing to his sciatic pain specifically. So, like I said, there's a whole slew of things that can be causing these issues. We have to absolutely get down to the cause of it for you specifically, but then set up that plan to get you guys feeling better. And that's what we do in those first 2 days in the office to make sure that we can get you guys 100% as fast as possible. So if you or anybody else dealing with symptoms like this, nerve pain, numbness, tingling, pain across that low back, waistband type area, call us at that number below. We're here to help. We look forward to working with you guys soon.